Hello, my name is Vartika Agarwal, and my infographic for my week 4 discussion is on breast cancer and African American women. The social ecological model is a theoretical framework widely used in public health and psychology to understand the multiple levels of influence on an individual's behavior and health outcomes. Since the profession of public health began, public health professionals have focused on one's individual knowledge and attitudes as the main determinant of health behavior. Professionals did not account for the social, cultural, and economic circumstances that influence health behavior. As a result, forms of the social ecological model were introduced by sociologists after World War I to further understand the relationship between environmental factors and behavior. In the 1970s and 1980s, a conceptual model was introduced. The socio-ecological model was made up of 5 levels: interpersonal, community, organizational, and public policy. The model posits that effective behavior change interventions should consider and leverage these multiple levels to create comprehensive strategies. I believe that the socio-ecological model is the best model for designing an intervention for our health issue of breast cancer in African American women. Our case study further proves this. Our case study highlights the processes of an intervention project to increase mammography rates of women in the American Indian Navajo tribe using a sociological framework and principles of community-based participatory research. This was done by partnership development and conducting several educational courses to advance community empowerment and familiarize community partners in the tribe with key public health concepts and strategies. Results showed that due to this intervention, 39 women received a mammogram. The intervention was also able to build public health knowledge and skills for tribal health providers, identify community-specific knowledge, attitudes, and beliefs related to breast cancer, adopt legal policy initiatives to bolster tribal cancer control, and several other benefits. Now, how can we actually apply this model to our issue? This has to be applied at each and every level, as those are our theoretical constructs. At the first level, the individual level, we can apply the do the following interventions. We can implement community-based education programs focusing on breast health, breast examination, and early symptom recognition, access to screening by providing information on free or low-cost mammograms. We can establish support groups and counseling services to address psychosocial factors like stress, anxiety, and depression, and train healthcare providers to offer culturally sensitive care. For level 2, the interpersonal level, we should encourage women to form peer support networks to promote regular screenings and share experiences. We should train community health workers or navigators to connect individuals with resources and navigate the healthcare system. We should promote effective communication between healthcare providers and patients, emphasizing the importance of early detection and adherence to treatment. At level 3, the community level, interventions can organize mobile clinics to improve access to mammograms and screenings, especially underserved areas. We can conduct regular health fairs in African American communities to provide screenings, education, and resources. We can also collaborate with local churches, community centers, and organizations to raise awareness and provide support services. At level 4, the organizational level, We can offer training programs for healthcare institutions and organizations to ensure culturally sensitive care, establish patient navigation programs within healthcare facilities to guide individuals through diagnosis, treatment, and survivorship. We can create comprehensive breast health programs that offer counseling, financial assistance, transportation, childcare services, etc. And we can partner with healthcare institutions to conduct outreach in African American communities and promote screenings. Last but not least, the level 5 policy level. We can advocate for policies that expand healthcare access, reduce costs, and ensure coverage for mammograms and cancer treatments. Lobby for policies that address health disparities and promote equity in healthcare delivery. Advocate for increased funding for breast cancer research, particularly focusing on disparities in African American communities. And encourage community activism and advocacy to raise awareness by challenging discrimination and influencing policy changes. By intervening at each ecological level, we can create a supportive environment that promotes early detection, access to care, and improved outcomes for this at-risk population. Using the socio-ecological model for public health intervention planning offers several advantages. The model considers multiple levels of influence, which allows for a more comprehensive understanding of health behavior and the development of multifaceted interventions. Also, interventions are often more sustainable because they can lead to systemic changes in communities and organizations. Although there are many positive aspects of the ecological model, there are also some challenges associated with this particular model. Interventions, especially those which involve multiple levels, can be costly. Time and money are needed for each intervention level utilized. In addition, coordination issues may result from attempting to intervene at multiple levels of the ecological model simultaneously. In conclusion, the socio-ecological model is a valuable framework for public health intervention planning due to its various levels of influence on health behavior. However, it is essential to strike a balance between comprehensiveness and practicality when using this model in a real-world public health initiative. Thank you.